Welcome to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
Welcome to a new episode of the JCIH podcast, Health and Communication Distilled, a podcast series from the Journal of Communication in Healthcare, Strategy, Media, and Engagement in Global Health. My name is Gloria Zucchini. I'm the current Communication Technology and Social Media intern for the journal. Today we have with us our author, Dr. Yamin Jahangir, and we will be discussing his research, service user and healthcare provider perspectives on barriers for men using sexually transmitted infection services in a public hospital of Nepal, a qualitative study. Hi, Dr. Jahangir, and thank you so much for being here with us today. Would you like to start by introducing yourself and summarizing the study in a few words?
Thank you, Gloria, and thanks to JCIH podcast series for inviting me today to talk about my research. I'm Dr. Yamin Tauseef Jahangir, and I have been working as a public health and health systems researcher for the past 5 years in South Asia and now in Canada. My research interests are wide-ranging, but central to all research projects is the application of social and behavioral change theories and using qualitative and mixed methods research to reduce public health services inequities. I did my PhD from the Faculty of Health at the University of Waterloo, and currently I'm working as a Post-Doctoral Fellow at Toronto Metropolitan University. The study of today's discussion is about exploring the perspectives of healthcare providers and Nepalese men as service users who access public hospital in Nepal regarding the facilitating factors and barriers to sexually transmitted infection services that they use. So our data identify complexities of delivering sexual health services to Nepali men and barriers to service use. The data suggests that there is a need for greater education regarding STIs and related services, and also consideration of the various cultural factors that influence service use in Nepal.
So I would like to start from a broader context regarding sexual health awareness in general among Nepali men. And according to your study, it appears that the sexual health needs of males are overlooked, probably because, as you said, reproductive issues are typically perceived as female-related. So do you believe that sexual health is something that men ignore in the society, maybe due to a deep-rooted patriarchal standpoint? And how big is the influence of religion on this matter?
Well, I will break this down by saying that in Nepal, STI services are available to men and women equally and are integrated with sexual, reproductive, and maternal health. However, the sexual health service needs of men have been overlooked from the health system's perspective, as when it comes down to reproductive health, services are typically perceived as female related. There is a paucity of research to understand whether the nature of sexual health needs of South Asian men or whether these needs are effectively met in a healthcare setting in Nepal. Now, having said that, system-driven barriers to accessing STI services in Nepal, including users' concerns regarding confidentiality, and economic constraints, as well as the absence of proper screening and detection services, lack of proper health promotion activities, and a lack of user-friendly healthcare service. These are all factors that have also influenced the overall decision-making of accessing and utilizing sexual health services in Nepal. So as from the patriarchal standpoint, it does have significant influence as well, given that the value system in a society that provides the context within which behavior is shaped, and the patriarchal culture in Nepalese society is also having certain kind of influence on the perception of men as playing a dominant role in decisions related to sexual matters. In terms of the influence of religion, the literature does suggest that ethnicity and religion in Nepal also have strong influence in sexual behavior through cultural beliefs and practices, such that from the like the age at first sexual encounter to their marital status to their lifestyle patterns, and also in accessing health information and services. So religion and patriarchal roles do have certain kind of, it factors in their overall decision making for accessing service.
That's very interesting. This study showed that users' health literacy regarding sexual health issues is very low. Do you think that an increase in health communication campaigns and educational projects, maybe starting, I thought, in secondary school, could be sufficient to increase the demand? And let's say the demand increases. Do you believe the health system would be able to meet those expectations?
To address the rise in STI infection among Nepali men, at present, Nepal has more than 100 government and non-government initiatives that provide sexual health services. However, even though these services are present, oftentimes we see that these services are fragmented. There is little factual information or guidance about sexual health or access to healthcare, particularly tailored for men. It is also important to tap into the health systems barriers that often hinder access to and utilization of sexual health services. For example, literature suggests that there is a deficit in culturally appropriate prevention and care strategies for male communities in many healthcare settings. And this is not so different from our study result findings that we have found in Nepal context, because as we found from our study, there still remains the perception of unequal power dynamics between users and healthcare providers, and that users are not so comfortable in disclosing their patient history and talking to a provider openly about their sexual issues. So that needs to be addressed through cultural competence training among healthcare professionals to address the drivers, values, and beliefs and behaviors. And that also includes tailoring the delivery by which the services are more user-centered, and that it encompasses the social and cultural needs for men as well.
Of course. And I would like to stay on the matter of health communication and awareness. So, what is, according to your opinion and your research, a way to break down the stigma around STIs in the Nepalese society?
Well, from our research findings, healthcare providers mentioned that men have poor health literacy regarding understanding sexual health in general, and did not know the difference between STIs and HIV or AIDS. And furthermore, lack of sexual health knowledge made majority of Nepalese men to remain ignorant about their health and well-being, and men often delay in seeking care. That is what the literature suggests as well. While majority of the health campaigns in Nepal focuses mostly on HIV or AIDS awareness, and the focus of HIV specifically may be related to the strong focus on what the campaigns actually portray through the media. However, such campaigns do not focus on STI prevention more generally, and may therefore shape the Nepalese perception of infection spread through risky sexual practices.
I'm glad you mentioned HIV and AIDS, because another thing that I found very interesting is the fact that both from the point of view of the care provider and the service user, fear leads to action, and fear of contracting HIV and AIDS more than any other STIs. In your paper, you use the term venerophobic. Can you please explain what do you mean by this word, and why in most cases does the emotion of fear drive the process?
One of the most interesting findings from this research study was to gain an insight about how Nepalese men perceive about STI illness. So from our interview data with the healthcare providers, we learned that fear of illness or health complications and a concern of contracting HIV or AIDS were identified as factors that facilitated users to seek STI care. In clinical encounters, users were more interested to know whether they had HIV or AIDS while being not so interested about STIs. So the healthcare providers in our study also mentioned the term venerophobia, or a person being venerophobic, which is a term that applies to a person who actually do not have STIs, but have a fear of a venereal disease. The issues of venerophobia actually is a reflection on how some group of men, particularly in rural communities, as we have found from our healthcare providers, and how they perceive sexual health complications and how they relate such infections with life-threatening conditions with STI disease, even though when they don't have that disease. From our data and literature on the current trends in STIs, clinics do indicate that venerophobia is not an uncommon presentation among youngsters and the youth population following an isolated or multiple episode of sexual contact. So this has a major bearing on the mental as well as the sexual health. So far, there is very limited research being done on understanding the prevalence of this venerophobia among youth or among population. So according to our healthcare providers from this study findings, we found that men would call them to come to the STI clinic and voluntarily do a checkup only to cure their disease. But the interesting thing is there's no disease and there's no STIs, but they have this fear of contracting it because they may have had multiple contacts or sexual contacts. And that entire phenomenon, the healthcare providers term it as venerophobia, like a phobia of having this venereal disease, even when they don't have this disease.
This study is primarily conducted among people who already use these types of services. How do you think your findings will apply, if in any way, to those who are not seeking assistance?
We have interviewed participants who were users of the system. So one of the limitations of our work was we did not interview non-service users. So it is therefore important that we believe that the future work should investigate the perspective of individuals who have not engaged in services, including both persons who have experienced STI symptoms and those who have not. So it is very likely that barriers to diagnosis or treatment of people who are using the system and the barriers or the complications of those who are non-users would be quite different. So I think our finding would take a step further in gaining a broader understanding on how to make sexual health service more patient-centered. And it will be better for the future research purposes to understand how to integrate non-service users into availing and accessing services even more. So, yeah.
Great, thank you. So we are coming to the end of the interview, and I wanted to ask one last question. What policy or intervention would like to see emerge as a result of your study?
I think our study findings should focus in the area of more patient-centered care, improve strategies on patient confidentiality and privacy in a clinical setting in Nepal, and a focus on revisiting the existing sexual health promotion resources available in Nepal and to integrate STI preventative care strategies to address the overall poor health literacy that are more prevalent in men, while maintaining all the cultural aspects for sure. It is also important to consider the psychological factors that influence sexual health education for men, as emotional and physical stress after an STI diagnosis that they go through can also create a major barrier towards further testing. So while looking into the integrating like STI into the health promotion or health education aspects, it's also important to integrate or to think about the psychological aspects of this and how people will actually accept or how they will be like processing those information when they move forward in making informed decisions about availing a service.
Thank you very much, Yamin, for being with us today and for all your precious insights and perspective. It's been great talking to you. Thank you again.
Thank you so much, Gloria, for having me. And thank you to the podcast series. And I enjoyed discussing my research with you today.
Thanks for listening to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.